Involves first acknowledgement and affirmation as the two ethical acts when a doctor or a nurse is with a patient. Acknowledging their problem and affirming their right to treatment is the initial part of it. That's what happens when you look in the eyes of a patient or a family, when you shake their hand, when you welcome them into the clinical setting. That's acknowledgement and affirmation. Okay? That's being impaired in many places by the fact that the nurse or the doctor has their back now turned to the patient because they're looking at the computer screen. Okay? So nurse practitioners in America, physicians in America, they often, the patient comes into the room, they're not even shaking their hand and looking at them. They're looking at the computer screen to find the electronic health record and what is on it. And so poor are these electronic health records from a design standpoint that they occupy an enormous amount of time of practitioners and pull them away from the patient and family. So nothing could be worse than having a patient walk into a clinic examining room and have the nurse practitioner or the physician with their back to the patient looking at the computer screen. Okay, that's number one, acknowledgement and affirmation. Number two is the practical work of caring. Most of this in the hospital now is no longer done by nurses, at least in my society. It's done by nursing assistants or health aides. And it's about helping patients ambulate, feeding patients, bathing patients, etc. All those things. Those are done in the context of the family. Family members do that. Home health aides do that. Nursing assistants do that. Doctors and nurses increasingly don't get involved in that sort of thing. Third area is presence. And I make the case in The Soul of Care of how important presence is. Being present. So you're teaching young nurses, it's their fullness of their being, the way they feel when they're with close friends and talking to them. You have a great culture of being with friends in coffee shops in Denmark. Okay, that kind of comfortable interaction of person to person, being personable. Okay, that is presence. That's presence. All right. Increasingly, in the institutional setting, we're seeing people who are so hurried, they're so pressured that they aren't present. They're just going through the ropes. They're mechanical. Okay. So presence is very important to caregiving. The next one is ritual and habits. This is particularly important for family carers, ritual and habits. I think the crisis, first of all, is time. Okay. I think it's time that we have so structured care today that there's not enough time to deliver quality care, whether in the clinic or the hospital. Second is is ironic. It's technologies that are developed to improve care actually worsen care. How does that happen? It's because they distract us from dealing with people. But actually, I believe in technology. I believe in technology, that technology can do many useful things. In my own area where I deal with aging, there are technologies that put AI and VR together that can allow patients with dementia to return in their own story to a comfortable space that reorients them in their life and takes away their agitation without medications, without drowsiness, without tying them down or isolating them. Technology is really important. The problem is the way it's often used it distracts us from dealing with the patients. And the best example of that, in my view, in my country, is the electronic health record, which has so much potential, but really is basically used for only one thing today, and that's to improve billing, sending out bills to people, okay? So if we think about doctors and nurses, we want to ask a utilitarian question. What can they do to improve the lives of people who are experiencing serious illness and have difficult to treat diseases, okay? And so what can they do? And I'm suggesting that what a nurse can do and what a doctor can do is to be more present, to ethically respect the patient and acknowledge and affirm their right to treatment, to help the patient, and this is a key term, to help people endure, okay? Chronic illness doesn't go away by definition, okay? Diabetes, heart disease, cancers, they don't go away. They stay in some form. Now, there are some that get some things that get cured, but much of chronic illness, asthma, arthritis, diabetes, is chronically managed. And in chronic illness, just a 10% reduction in seriousness of symptoms, a 10% reduction, is often the difference with someone having an illness, chronic illness, but being able to go to work, go outside and do things with the family, go on picnics or trips, or someone who's housebound and bedridden. All you have to make a difference is about 10%. So how do you reduce symptoms 10%? And I believe that caregiving in and of itself can accomplish that. The most important thing I'm trying to do is to make care the central value in healthcare systems. It's not the central value today. In healthcare, most healthcare systems in the world today are, even if most are privatized, and the central value is making money, okay? No good, in my view. Care must be the central value. Secondly, all healthcare systems, including yours, are bureaucratized. And the bureaucratic values, which Max Weber so brilliantly wrote about in the past, the technical rationality of bureaucracy, that's not what we're talking about in good care, okay? That's what gets in the way. So the single most important thing to do is to insist that care must be the fundamental value of healthcare systems. We are building a future healthcare systems in which care is not the central value, and that this is not the way most people want to live or be taken care of or enter into old age, etc. People want care. They want these things. Families want these things. But so dominant is economics and administration that we've lost the whole purpose of what healthcare is about, okay? And I think we need to return to that. I don't think $10 million is going to be enough to do this. But you see, if people like you guys and me and everyone who's got a skin in the game, because we all have skin in the game, we all need healthcare. We all want it to be excellent. If we insist on quality care, if we say we're not accepting poor care, then I think it'll happen.